Bob Emerson came to us a couple of years ago with this idea to embed pharmacy students and faculty into our family medicine residency programs, and we just thought that was a great idea.
It was very important to me that we establish relationships here with not only the School of Medicine, but also with Wichita State. We think having the students learn in an interprofessional setting with the healthcare providers that we're going to be working with in the future is very vital.
Interprofessional training is becoming a very necessary part of our schooling between medical students and pharmacy students. The sooner that we can get that training and the education together, the sooner that we can start creating those relationships and the bonds between the doctors and the pharmacists.
And they're already forming those relationships rather than waiting until they get out onto their clinical rotations or into their career and having to build those relationships. They'll already have contacts.
It's been something that I'm very thankful for, and I'm happy to see where I'm going in the future has clinical pharmacists that are available. They would be sorely missed if we went somewhere that didn't have them.
What we really know in family medicine is that by having pharmacists around who have that type of expertise and being able to throw them the tough questions and get help, we actually provide much better care for our patients.
I really do enjoy having the pharmacy students around because I do go to them a lot to ask for evidence-based medicine. They're very helpful in that sense, and they get back to you. They're very eager to learn as well.
You're really spreading out the responsibility of the treatment to where everybody's carries responsibility for the patient care.
Patient care makes a world of difference. As physicians and medical students, you can tell a patient, kind of how to take it, but they can really give you a better understanding of, what the drug is, what it's going to do, the side effects, and then some general pharmacological education to the patient to really benefit them farther down the road.
I had a patient, he was kind of getting some knots on his stomach where he was injecting his insulin. So it was a perfect opportunity for us to sit down with the medical student and the attending physician and say, I think we need to talk to this patient a little bit more about how they're injecting their insulin. Turns out all he needed to do is just kind of move that injection site around a little bit.
In medical school, one of the things they're really training us to do is to be leaders of the healthcare team in the modern day healthcare system.
Developing that connection from the ground up, it helps create a health system hopefully in the future where there's a lot more communication and not as many segmented roles.
We have that opportunity to be on the same campus. Our students are learning together, and so I think it's great we're able to bring those two programs closely together in one community.
Not only are you doing a good service by increasing the overall health of the community right now, but in the long run, you're going to do yourself a service by giving yourself better practitioners once all of us graduate.
Working together from an early stage can only help to strengthen those bonds as they become practitioners out in the real world.